Your blood pressure was high once. Does that automatically mean you have hypertension? Not always. In the next few minutes, I'll explain what the numbers mean, why readings can vary, the most common causes, and what GPs usually check next in the UK. This is general information only, not medical advice. If you're worried about symptoms or your results, speak to your GP. Blood pressure is written as two numbers, like 120/80. The top number is the systolic pressure. This is the pressure when the heart pumps. The bottom number is the diastolic pressure. This is the pressure when the heart relaxes between beats. Blood pressure naturally changes throughout the day. It can rise with stress, pain, exercise, caffeine, or sleep, or even just rushing to an appointment. So one reading is a snapshot, not your full story. Many people notice their blood pressure is higher at the clinic than at home. That can happen due to anxiety, sometimes called the white coat effect. In general terms, clinic readings are often considered high, around 140/90, while home readings are often considered high, around 135/85. But targets vary depending on age and medical history. Your GP will advise what applies to you. If your BP was high once, the usual next step is repeat reading, often using home blood pressure monitoring over several days. Let's talk about common causes. In many cases, there isn't one single cause. It's a mix of factors. Cause 1, lifestyle and salt. High salt intake and lots of ultra-processed foods can push blood pressure up in many people. Cause 2, stress and poor sleep. If you're sleeping badly, anxious, or under constant stress, BP readings can run higher. Cause 3, weight and low activity. Excess weight can increase blood pressure, and regular activity often helps bring it down over time. Now, sometimes blood pressure is high because of an underlying condition, but that's less common. Examples include kidney-related issues or hormone-related causes. That's why doctors look at the full picture rather than just one number. So what do doctors usually check next? First, confirm the pattern. They may ask you to check BP at home, usually seated, rested, and at the same times each day, and record results. Second, review medications and triggers. Things like decongestants, some painkillers, or stimulants can affect blood pressure in some people. Third, basic blood and urine checks. Common tests include kidney function like creatinine and eGFR, sometimes a urine test like ACR to check for protein leak, plus metabolic tests like HbA1c and a lipid panel. These don't diagnose BP on their own, but they help assess overall risk and related causes. Your GP may also check weight, smoking status, alcohol intake, and family history. Seek urgent help if you have severe symptoms such as chest pain, severe shortness of breath, weakness on one side, severe headache with confusion, fainting, or if you feel seriously unwell. In the UK, you can use NHS 111 for urgent advice and A&E for emergencies. Quick recap: 1, high BP. Reading doesn't always mean hypertension. Doctors usually confirm with repeat readings or home monitoring, then look at lifestyle factors and check key labs like kidney tests, HbA1c, and lipids. If you want, I'll do a follow-up video, how to measure blood pressure correctly at home. 3 common mistakes. Comment home BP and follow for more UK Lab and Health Explainers.